So why does my chest hurt? That's one of the biggest questions that a lot of my patients come to see me for. They may be having pain here, they may be having pain in the shoulder, but it always starts off with what's causing my chest pain. And for each individual, it is different. So if someone is younger, more likely it's not due to coronary disease. But I've also seen people as young as 20, 22 have a heart attack. So what do I do when someone is coming in with chest pain to work them up? Number one, I'm going to work everyone the same way with getting the good history, getting a physical exam and getting labs, and then depending on the labs and the imaging may stray from one way to another. For instance, if an older individual that has a lot of risk factors for heart disease such as hypertension, diabetes, a strong family history, and smokes, then I'm inclined to get an stress test to figure out if we need to investigate this further with a heart catheterization. Versus if I have a young individual that doesn't smoke is coming in with chest pain, I may be inclined to maybe walk them on a treadmill to see if it can elicit something, but also look at other potential things that can be causing the pain. Could it be issues with the gallbladder? Could it be issues with the pancreas? Could it be issues with the GI system? A lot of the times these other organs can present with chest pain. But if someone doesn't have a lot of risk factors, younger age, want to try to, not do as aggressive workup initially, get the simple test that can get the answers that is needed. Treadmill, for example. Sometimes even an ultrasound, an echocardiogram of the heart to look at how well the heart's squeezing, how well it's relaxing, any issues with the heart valves, any fluid around the heart. But I feel like a lot of times things do, if people have enough symptoms, if they have enough questions, that they may need further investigation. They may need a coronary angiogram. And they can be done in one and two ways. You can do a CT scan, a CAT scan to look at this. Benefit of that is that it's less invasive. On the other hand, you can do a cardiac catheterization. Benefit of that is, though it is invasive, if there is an issue, you can fix it, potentially. Catheterization. Going back to the CT scan, if they have abnormalities in the CT scan, then the follow-up plan is going to be to get a cardiac catheterization. So there may be some benefits in doing one versus the other. The younger the individual, the more you may benefit from doing the CT scan. The older with more risk factors, possibly doing a cardiac catheterization. So if we do all these testing and everything comes back normal, does it mean that they don't have any cardiac issues? Potentially, but understanding once again other things that can cause chest pain, but understanding that people can have microvascular disease, which is the tiny arteries that we cannot see that can be causing some of these symptoms. Biggest thing that can cause that is smoking. So one of the biggest treatments for those individuals is lifestyle changes. Reducing the amount of smoke, controlling their blood pressure. Some people, and the same goes for people who have vasospasms, spasms of the heart arteries, controlling the risk factors, stress, smoking being two of the biggest ones. So if someone is coming in with chest pain, I want to take it seriously. I want to look at everything that can be potentially causing it. I may stray and do a stress test for one versus the other. I may do an echocardiogram. But if I have enough questions, I may proceed with doing a cardiac catheterization. And depending on the results of the cardiac catheterization will give us a lot of information. One of the biggest ones that I always find, especially for people who have normal heart tests, is to look at the lungs. Specifically, do you have sleep apnea? I've seen that a lot of my normal cardiac workup ends up leading to me doing a lung evaluation with a sleep test, and they end up having sleep apnea. When that's treated, a lot of your symptoms get treated also. Sleep apnea can cause a lot of different things, including chest pain, chest discomfort, palpitations, high blood pressure, but more importantly, difficult to control blood pressure. So if you're having symptoms and it's beginning with chest pain, go and see your primary care provider, get the appropriate workup, and if you need it, you may need to be seen by a cardiologist. If testing is normal, we don't stop there. We continue asking further questions, sometimes even leading towards doing a sleep test to make sure sleep apnea is not one of the causes, but also depending on the risk factors, depending on the presentation, may look at other organs, look at the GI tract, look at the gallbladder, etc. My name is Dr. Isang, and if you got any benefit, hit the subscribe button.